Stages of labor. The stages of labor explain what you can expect to happen from the start of regular contractions through the delivery of the placenta. Healthcare providers use these stages to ensure your labor is progressing in a healthy way. Each labor experience is unique, but knowing what to expect in general can help you feel more prepared. The stages of labor are the process through which you deliver your baby and the placenta from your uterus through your vagina. In general, the three stages of labor are Stage 1 labor contraction, Stage 2 pushing and birth, Stage 3 delivery of the placenta. Your doctor may call this normal labor. They use this definition and the stages to communicate effectively with each other and you. Just because you don't go through every step of normal labor doesn't mean there is something wrong with your birthing experience. You can experience some stages of labor, but your baby may arrive via C section, or you may never experience the first part of labor, like if you have a planned or emergency C section. It may also be different if you have induced labor. Each labor experience is unique. It can be stressful not knowing exactly what to expect for such a significant event. While pregnancy care providers know the general outline, they can't predict how your labor will go. But rest assured that they will be by your side to guide you through the process. You have the shared goal of the healthy labor and delivery. Stage 1: Early labor and active labor. The first stage of labor and birth happens when you begin to feel ongoing contractions. These contractions become stronger and they happen more often as time goes on. They cause the cervix to open. This is called dilation. The contractions also soften, shorten, and thin cervix. That process is called effacement. It allows the baby to move into the birth canal. The first stage of labor is the longest of the three stages. It's divided into two phases: early labor and active labor. Early labor. During early labor, also called latest labor, the cervix opens and softens. It also gets shorter and thinner. The cervix opens less than 6 centimeters in early labor. Contractions tend to be mild and they may not happen consistently. As the cervix begins to open, you might notice a clear pink or slightly bloody discharge from your vagina. This likely is the muscus plug that blocks the cervical opening during pregnancy. How long it lasts? Early labor isn't predictable. It may stop and start. The average length varies from hours to days. It's often shorter from people who have had a baby before. What you can do. For many people, early labor isn't particularly uncomfortable, but contractions may be more intense for some, and sometimes contractions may continue for a long period of time during early labor. Try to stay relaxed. The following may help keep you comfortable during early labor. Go for a walk, take a shower or bath, listen to relaxing music. Try breathing or relaxation techniques. Taught in childbirth class, change positions. If your pregnancy is in high risk, you may spend most of your early labor at home. Most of the time, pregnant people don't need to go to a hospital or birthing center until contractions start to get more intense and happen more often. Talk to your healthcare professional about when to leave for the hospital or birthing center. If your water breaks or you have a lot of vaginal bleeding, contact your healthcare professional right away. Active labor. During active labor, the cervix opens from 6 cm to 10 cm. Contractions become stronger and closer together. They also happen more consistently. Your legs might cramp, your stomach may feel upset. If it didn't happen earlier, you might feel your water break. You also may feel more pressure in your back. If you haven't headed to your labor and delivery facility yet, now's the time. Your initial excitement may fade as labor goes on and you get more uncomfortable. Ask for pain medications or anesthesia if you want it. Your healthcare team works with you to make the best choice for you and your baby. Remember, you are the only one who can judge your need for pain relief. How long it lasts? Active labor often lasts 4 to 8 hours or more. On average, the cervix opens at approximately 1 centimeter an hour, but it may take longer for people who haven't had a baby before. What you can do? Look to your labor partner and healthcare team for encouragement and support. Try breathing and relaxation techniques to ease pain. Use what you learned in childbirth class or ask your healthcare team for suggestions. Unless you need to be in a specific position to allow for close monitoring of you and your baby, try the following to be more comfortable during active labor. Change positions. Roll on a large rubber ball, birthing ball. Take a warm shower or bath. Take a walk, stopping to breathe through contractions. Have a gentle massage between contractions. If you need a cesarean delivery, also called a C-section, having food in your stomach can lead to complications. If your healthcare professional thinks you might need a C-section or if you have a epidural for pain relief, you may be limited to small amount of clear liquids such water, ice chips, popsicles and juice instead of solid foods. The last part of the active labor can be particularly intense and painful. Contractions come close together and can last 60 to 90 seconds. You may have pressure in your lower back and rectum. Tell a member of your healthcare team if you feel the urge to push. If you want to push but your cervix isn't fully open, you will likely need to wait. Pushing too soon could make you tired and cause your cervix to swell. That might delay delivery. Pant or blow through the contractions. This part of labor typically is short, lasting about 15 to 60 minutes. Stage 2. The birth of your baby. It's time you deliver your baby during the second stage of labor. How long it lasts? It can take from a few minutes to a few hours to push your baby into the world. People who haven't had a baby before and those who have an epidural typically need longer to push compared to those who have had a baby or don't have an epidural. What you can do? Push. Your healthcare professional asks you to peer down during each contraction or tells you when to push, or you might be asked to push when you feel the urge to do so. When it's time to push, you may experiment with different positions until you find one that feels best. You can push while squatting, sitting, kneeling, even on your hands and knees. A member of your healthcare team can check progress during pushing to help you know if your efforts are working. At some point, you might be asked to push more gently or not at all. Slowing down gives you vaginal tissues time to stretch rather than tear. To stay motivated, you might ask if you could feel the baby's head between your legs or see it in a mirror. After your baby's head is delivered, the shoulders are delivered, then the rest of the baby's body follows shortly. The baby's airway is cleared if necessary. If the delivery didn't involve any health concerns for you and your baby, your healthcare professional may wait a few seconds to a few minutes before the umbilical cord is cut. Waiting to clamp and cut the umbilical cord after delivery increases the flow of nutrient-rich blood from the cord and the placenta to the baby. This raises the baby's iron stores and lower the risk of anemia. That helps with healthy development and growth. Stage 3, Delivery of the placenta. After your baby is born, you will likely feel a great sense of relief. You might hold the baby in your arm or on your belly. Cherish the moment, but there is still a little more to do. During the stage of labor, you deliver the placenta. How long it lasts? The placenta typically is delivered within 30 minutes. What you can do? Relax. By now, your focus has likely shifted to your baby. You might not be paying attention to what's going on around you. If you have tried breastfeeding your baby, mild, less painful contractions that are close together continue after delivery. The contractions help move the placenta into the birth canal. You push gently one more time to deliver the placenta. You might be given medicine before or after the placenta is delivered to encourage uterine contractions and minimize bleeding. Your healthcare professional examines the placenta to make sure it's in one piece. If any pieces of the placenta are left in the uterus, they must be removed to prevent bleeding and infection. If you are interested, ask to see the placenta. After you deliver the placenta, your uterus continues to contract to help it return to its usual size. A member of your healthcare team may massage your belly. This helps the uterus contract to lessen bleeding. Your healthcare professional checks to see whether you need repair of any tears of your vaginal area. If you didn't have an epidural, you will receive an injection of local anesthetic in the area to be repaired. This special time with your baby, your preparation, pain, and effort have paid off. Enjoy the miracle of birth. Thank you for watching. Subscribe for more.